Hi loves, welcome back to my YouTube channel. My name is Laureen Dube, also known as the Dynamite Survivor. I hope you guys are well and you guys have been keeping safe and you are surviving. So thank you so much for tuning in. On today's video, I am going to be talking about how to do a breast self-examination. So just a quick recap on last time's video. We spoke about the signs and symptoms of breast cancer. So what you would be looking for when you're doing this self-examination would be redness on your breasts, rash, nipple discharge, lumps, change in texture of your skin on your breast, swelling on your armpit. So those are the main signs that you need to be looking for. So this is how you look for those signs. So we have two options for you to look at your breast and self-examine. So either you do it while you are standing in front of a mirror. Obviously you would need to take off your top and your bra, or you do it while you are lying down on a bed or a couch facing the ceiling. So I'll firstly demonstrate on how you do it when you are standing in front of a mirror. So what you need to do is you need to completely relax your shoulders, completely. So you make sure that you completely relax your shoulders and stand quite close to the mirror so that you are able to see closely, on both your breasts. So you just then have to go ahead and look through the mirror, look for any abnormalities, change in size of your breast, change in texture, any rash, any pimples, any swelling on your breast, any crack or sores on your nipples. Also, you need to be able to see your armpit, and also this area is very important, the area between your breast and your armpit. So there's a little area. Most people, when you touch this area, it feels like a muscle or something, but it is, I think it is a muscle, but you need to be able to see that area. So you literally have to turn and face the other way in order for you to be able to see this part of your breast. And also another thing that you need to do when you are standing in front of your mirror, you need to raise your arms above your head and look very closely at both your breasts. So this is how I normally do it. I just cross my arms behind my head and look closely in the mirror. And then the next one that you need to do is to hold your hips and continue checking for any changes. So literally the way you hold your chest or your arms, or the way you position yourself, there is changes that happen within your chest muscle that sort of protrudes. Isn't this, guys? Protrudes, whatever you call it, that sort of shows more whatever is happening in this area, in your chest area. Ne? I hope you got that right. And then the second one, if that you can do while you're standing in front of your mirror, is to literally feel your breast using your hands. So you need to be able to do it up and down. So literally like this, up and down. You exert a little bit of pressure on your breast in order for you to be able to feel the inner muscle of your breast. So up and down, up and down. So you need to cover all areas of your breast, up and down, all areas of both your breasts. And then what you can also do while you're standing in front of a mirror, you can self-examine using circular movement. So circular movement, circle, guys, like this. This is how you do it in circular movement on both breasts. Obviously I'm doing it more because this is my left, so I normally do it on my left. The other one is the fake one. And the next one that you need to do is to be able to do from the top part of your breast to the nipple. So you top, slow down to your nipple, so covering all angles of your breast. So if you have like bigger boobs, what you can do is you can use one hand to sort of lift your breast so that you're able to check this part, like this, like this. So it's very important for you to be able to position yourself in a comfortable position where you are able to literally cover all areas of your breast. That's very important. And then the next one that you need to do, you need that you can do to check if there's anything wrong with your breast, you should raise one arm, yeah, and then you use the other one to check if there are any irregularities like lumps or sores or whatever on your breast. So let me do it this way. So you raise one arm and then you use your other arm to check. So you use those motions, circular or up and down, or up to your nipple, not forgetting this area. And also what you need to do is you need to observe through your mirror if your armpit is swollen, or if there is a persistent rash, or your lymph nodes are very much visible. And sometimes you can feel a bit of hardness, sometimes you don't. But also just remember one thing, that if you feel any hardness in those areas, it does not necessarily mean that you have breast cancer, guys. I've said this multiple times and I'm going to say this again and again. And so that's how you normally check for your signs and symptoms of breast cancer. And the most important thing that you need to make sure that you know is that you need to check your breast at least twice to 3 times a month, and you do this 7 to 10 days after your periods. Remember, when you are menstruating, your breasts change a lot, so sometimes you get a little bit of lumps that disappear after your periods, or sometimes your breasts are too soft, or sometimes you get acne on your chest area, or sometimes you just feel like, you know what, your breasts are a bit, bigger than usual, which is normal because your hormones are going through changes during that time. But outside of your period, if you see any of those changes, please make sure that you seek medical attention. So that's all, guys. And also another thing that you need to understand is that with the ultrasound, they actually do these same things that I've spoken about, the circular, they actually do that with an ultrasound. The only difference is that the doctor will be using that machine and they pour a gel on your breast and they'll be seeing it from a screen, but it's literally the same. So if you're able to master how you do that, then you're good to go, because you in that way you're able to learn your breast. You know the size of your breast, you know the texture of your breast, you know that when you're ovulating, this is how your breasts look like, this is how your breasts feel. And when you are menstruating, these are the changes that you normally have on your breast. So it's very important for you to know your menstruation cycle and the changes that your body goes through during that period. And once you master that, you would be able to see that if there is anything out of the ordinary, then you know what to do. Contact your local GP, your local clinic, for further assessment on your breasts. Thank you guys for watching, and I hope this video has helped somebody to learn how to do a self breast examination. Don't forget to give this video a thumbs up. If you have not subscribed to this channel, please be kind enough and subscribe. And also please share this video with your friends and family as well. Thank you. I will see you on my next video. Take care and ta-ta for now.